Joshua Austin here with the Dentistry IQ Product Navigator video portal. Today we're going to talk about Anutra Medical Dental Anesthetic Buffering System.
All right, so here we have the Anutra Medical Dental Buffering System, and I'm going to go through what all the parts of that are. So to start, we have this kind of tower, as they call it. To me, it looks kind of like the Flatiron Building in New York City. And this is kind of what lives on your countertop, on your desktop, and you'll prime this and load your anesthetic out of this, and everything kind of fits on the inside here. And this little blue top kind of comes off right there. And there's the internal workings and all that kind of stuff. We'll put this back on, and this is kind of what houses everything here. This little turn dial knob up here is kind of what you do to turn and dispense and all that kind of stuff, and we'll go over all that stuff. This is their kit that has all the goods in it, all the medicine in it. So if you pop this thing open, I'll kind of show you what all is in here. So we have a few different things in here. First and foremost is this. This is the cassette, and so this has basically all the hardware here that you will use to buffer anesthetic. And so if you flip this thing over, this thing comes in a sterile package, and you want to try to maintain that sterility as much as you can. I don't have on gloves here, so I'm going to try to maintain that as best as possible, but I'm probably not, this is for demonstration. I'm not going to be using this for patient care. So when you do this in your office, you're going to want to do this with gloves on. But your sodium bicarbonate is going to go into there, your lidocaine is going to go into there, and this is actually where really the heartbeat of the system is. This is what allows for the mixing of the two without without any backflow and all that kind of stuff. This part right here is really where all the magic happens. So this is the cassette, and this is going to be really important here in just a second. Also in here we have our sodium bicarbonate right here, and in the side here we've got some lidocaine. And this is just lidocaine, 2% with 1 to 100,000 epinephrine, very similar to what you use in carpules in your office. So that's that stuff. We also have their syringe here that we're going to use to actually inject, and we're going to load into this. And then this littler syringe is their priming syringe. I'm going to show you how to do that. And then obviously just a needle tip that's going to go onto this guy right here when we're ready to actually inject into the patient. So I'm going to set that stuff off to the side, and we're going to focus on this. Okay, so I've got the sodium bicarbonate open here, and that's really where we're going to start. So this is what's inside that brown labeled box. This is that kind of special syringe that I was talking about. So what you're going to do is you're going to pop this little deal off here. You're going to unscrew this little deal. You're going to take this little yellow thing off here, and you're just going to screw this up onto here until you get some liquid out of it, just like that. I'm going to set that off to the side. We're going to open up our tower here to make sure that we are ready to go. And now we're going to open this thing up. So like I said before, this is a sterile kind of deal here, so you want to probably do this with gloves in your office, but you can do that without if you're careful, and we're going to try to do it that way. So I'm just going to take this kind of luer-lock style. The sodium bicarbonate goes down onto there, and so now we're set there. I'm going to take the lidocaine, flip the red cap off, and now I'm just going to press this. There's a little green stake right there that's going to stab down into the rubber stopper of the lidocaine. And you got to press kind of hard there, and you'll hear that pop just like that. So now we're going to get rid of this, and now this thing slides into here. So we're going to slide this thing right into here just like that, and then pop this little blue door back on, and just put this, there we go, just like that. Hear that nice and closed, and here we are welcome to New York. Our Flatiron building tower is ready to go. So now what we're going to do is we are going to prime this. And so to do that, we're going to take this priming syringe here. And so I'm going to pop this thing open. Just screw this on to there. That's luer-lock style, so that should screw on really nicely and tightly. And there we go. Now we're nice and tight there and ready to go. So now I'm going to turn the gray knob here, and that's going to engage the sodium bicarbonate. And what we want to do is I want to turn this gray knob until we see the stopper kick back on that syringe, the priming syringe that's in there. So I'm just going to keep turning here. And I can feel the pressure building. There we go. And now we've got that kicked out like that. So now what I'm going to do is I'm going to draw all that up, and now I've dissipated all the pressure that's built up into there. And if you kind of look in there, you can see it's a little bit cloudy, so there's probably a little bit more sodium bicarb in there than would be in a normal mix. Not quite as clean as we would want it to be, but that's why we're priming in here. So I'm going to twist that off. Just shake off the end there. I'm going to throw that away, and now we're ready to dispense. And so this goes into our. Now we're going to head over to the really nice Anutra feedback aspiration syringe. So you got to use their special syringe with this. That's a disposable syringe. So you're going to use these are kind of one patient use only. But you can see they are aspirating syringes, and they do feel nice. They click a little bit if you hear that. So these are really nice syringes, and as you can see, we've got a luer-lock on here that just fits right on here, just like this. And I'm just going to snap that on there just like that, twist it on. And so now we're gonna dispense. So now, for every click of this gray, we're gonna draw back a milliliter, and you'll feel a click there. And so now we've got 1 ml of buffered lidocaine, 2% with 1 to 100K epinephrine, buffered with sodium bicarbonate. So the average carpule that we all use, or most of us use in our practice, is about 2 mLs. It's 1.8. So let's say you wanted to do that. You're going to do it one more time, and then go back one more time. So now we've got about 2 mLs there. And so that would be very similar to 1 carpule. The nice thing about this syringe, though, is what if you want to give more than that? What if you're working on a hot endo tooth, or a tooth of a patient that has some issues getting numb? What if you want to do 3 mLs? Well, turn this again, go back again. What if you wanted to do 4? Same thing there. So if you can see how clean this solution looks now. Now that's nice and clean and clear, and we're in good shape, and we're ready to inject. So for every time you click this, you aspirate 1 ml. And so you always have to click and then aspirate, click and then aspirate. And so you always get 1 ml at a time of solution. So if you wanted to do 4 mLs like we did here, you can't just click it 4 times and then draw back 4 milliliters. You're not going to get the right mixing of the buffering on that. So you really need to do it 1 and 1, 1 and 1, 1 and 1, 1 and 1. So here we've got 4 mLs. I'm going to untwist this here. We're going to take a look there. Again, nice and clean. We've got that little bubble there. You can clear out that blank space, just like you normally would, and everything looks pretty good. A little excess on the tip there, just shake that off, and we're good. And so, never in your wildest dreams would you have thought buffering would be this easy. Now it's just a matter of putting on whatever tip you want to use to inject, and we are ready to go. That's a luer-lock again. And so, here we go, we're ready. Again, these syringes are very nice. You can aspirate with them, make sure you don't get any bad blood in there. And you're ready to inject with 4 mLs of perfectly buffered 2% lidocaine with 100% epinephrine buffered with sodium bicarbonate. So your advantages on this is you're going to get more profound anesthetic. Patients that have a harder time getting numb, would be really well on this. Would do really well on this. And one of the biggest things is how quickly this stuff sets in. I mean, obviously with buffered anesthetic, stuff is going to set in very, very quickly. And so that's really where your production comes in, is that you can start working quicker on an upper tooth. You kind of start working right away. On a lower tooth, then a minute or two, you're ready to roll. So things are looking pretty good here. Once again, that's Anutra Medical, buffering system. Basically, so you only need to do the big priming with the whole syringe. With this thing like we did, you only need to do that the very first time you put it into the tower here, into your flat iron building. After that, you just need to do 1 ml a day. So just 1 click and 1 drawback a day, and you're ready to go for the day. So there is some kind of daily maintenance here. Once activated and once mixed, the sodium bicarbonate will stay good for 7 days. Okay, so if you're using this, you need to change it out every week, right? Anutra has a platinum service where they get you basically all of your disposables, your priming syringes, these syringes, needle tips, all that kind of stuff for free if you're a member of that. And so it makes it much more economical. And so when you factor in the time that you save and not having to fight getting patients numb, because this pH is much more likely to get someone numb, there is some production benefit to be had from this. So take a look at this Anutra. I think it works really well. As I said, they've been doing buffering in medical for a really long time, since at least 1989, and so if not before that. And so it's time that we really start looking at it in dentistry. I think there's a real blank space in the dental industry for using something like this, to help getting patients numb, something that we do every single day. And I never really feel out of the woods until a patient's nice and numb. And so if this can get me there quicker, then I think we're in good shape. So I wish you'd take a look at this Anutra Medical dental buffering system. Please let me know if you have any questions, and you guys have a great day. Thank you.